Thank you, Madonna, and welcome to everyone. I really hope that this will be a very memorable, interesting and informative meeting and successful Congress for you all. The President's address is traditionally an opportunity to look back over the past year and to look forward to the ongoing challenges that face us. Somewhat of a challenge to a President who's been in office for 38 days, but I'm willing to give it a go if you are. Looking back, I would first like to acknowledge Richard Royal, who stepped down from the presidency on the 12th of February. Richard joined the APHA board in 2005 and became the vice president in 2006. Interestingly, that was the year I did this job for the first time. He was elected president in October 2014. We will be honouring Richard at the soiree this evening, so I will simply say right now that we do all owe Richard a great debt of gratitude for the effort, dedication and commitment that he has so generously given to APHA over the past decade and a bit, but particularly for his enthusiastic championing and advocacy of both the APHA and our industry over the past 16 months as the President. One of Richard's legacies is the breadth and drive that he brought to the APHA advocacy at the national level. Over the course of the current federal government, there have been more than 14 major national reviews and many smaller ones. They've impacted directly on our industry. This chart, although a little messy, does show just the big ones. And the APHA logo is inserted where we have made submissions and had direct engagement with the review process. Some have completed, but many are ongoing. Of course, the feat of keeping up with all of this activity is no easy task. Our policy and advocacy work is primarily supported by the Policy and Advocacy Task Force, which is chaired by our Vice President, Danny Sims. This task force has overseen the preparation of those 14 plus major submissions during 2015. They've also received advice and specific specialist working groups convened to consider issues in relation to the pharmacy in the private sector, as well as chemotherapy funding, the prosthesis list, and e-health. They've also grappled with the issue of the growth in private patients in public hospitals. With the industry-wide trend towards increased levels of auditing by health insurers, they've also turned their attention to the question of how the cost impost and administrative burden incurred by hospitals may be alleviated. Looking forward, we face another federal election, one which could be particularly interesting if the Prime Minister chooses to seek a double dissolution. Given the election timeframes, the federal government is unlikely to propose major changes in the immediate term, although there are several major processes that remain in train: the MBS review and the review of community pharmacy remuneration and location rules, to name just a couple. Then there's also the federal budget. It is hoped that the budget will maintain funding to internships and clinical placements in the private sector, although increases in funding are unlikely beyond those increases in the specialist training places, which were announced in the mid-year fiscal outlook, and are actually going to be funded through a relocation of resources to support training in regional areas. It is possible that the federal government will include implementation of short-term recommendations from the Primary Health Care Review, although there has been no indication as to the federal government's response as yet. Over the past 3 years, some really big issues have been raised amongst all of these reviews, and the APHA message to whoever wins the election is please don't let them get lost. And rest assured that we at APHA will be making sure that they don't, and that private hospitals' voice is heard and engaged with. Challenges facing the whole sector, Chronic Care came out in the Hambleton Review. The role of competition in human services from Harper. Can localised planning and purchasing lead to better coordination? The Mental Health Review. And market failure, private health insurance through the ACCC, and certainly Rod Sims, the chairman, has recently announced competition and consumer issues in health and medical sector will remain a priority for them through 2016. There is absolutely no question that the issue of chronic disease management poses a major challenge for health systems and governments worldwide. The Primary Healthcare Advisory Group, led by Steve Hambleton, helped bring this issue into sharper focus, and we do look forward to the federal government's response to the important project. Through 2015, this challenge was often spoken of as a problem of too many hospital admissions, a problem to be solved by just the primary healthcare sector. And it is undoubtedly true that there is a need to look at the way in which primary care is delivered, funded, and coordinated through our system. But in the submission that APHA lodged, we strongly argued that the private hospital sector is also a part of the solution, and it is something that we will continue to prosecute. For many years, our sector has aspired to be innovative and to provide patient-centred care solutions. But we've struggled to find insurers and purchasers who will come on this innovation journey with us. Funding silos all too often get in the way. There are many trials, but trials lead to stop-start initiatives without maturing into longer-term investment. Pilot programs are often started and continue on in isolation, usually capped and all too often closed. Regulation at the moment prevents us from responding to consumer needs, particularly in pharmacy, where we could do more and want to do more for patients, but are prevented in doing so. Undoubtedly, one of the biggest chronic health challenges is mental health. And again, this area was the subject of a major review to which the federal government responded late last year. Every year, Australian private hospitals provide care for around 34,000 people living with a mental illness. Our case mix is different to that of the public sector, yet acuity is no less severe. We make a real difference, but consumers struggle to access the services that would decrease their risk of readmission. And we struggle to find insurers and purchasers willing to work with us in providing innovative solutions and services that would meet this need. The government's response to the Mental Health Review is interesting, not only for those involved in mental health, but also because the federal government has chosen to use primary healthcare networks as the primary instrument of the re-implementation. PHNs will be charged with developing regional service plans and will assume responsibility for allocating the majority of federal resources allocated to mental health. While current funding allocations have been largely maintained in the initial 12 months, this process could ultimately lead to a major reallocation of resources. PHNs are required by the federal government to engage with both the public and private sectors, and the APHA is doing everything that it possibly can to encourage and support this effective engagement. The response to the Mental Health Review is in many ways a piloting of an approach to planning and resource allocation, which we may soon see applied to many other areas. As Madonna mentioned, I chair the Psychiatric Committee, and I would like to acknowledge the hospital members and consumer representatives who make up the rest of the committee for their dedication and commitment. 2015 was a very busy year, with the continuing issues facing psychiatric benefits escalating, and I don't think it's going to get any easier through 2016. This committee also supports the sector's participation in the Private Mental Health Alliance, which brings together the key stakeholders in private mental health sector. 2016 sees the Psychiatric Committee rolling out a series of forums and workshops to provide education and development to our psychiatry members, particularly in relation to the PMHA's centralised data management service and its clinical and consumer outcome measurement data collection and reporting, as well as the addition recently of the consumer perceptions of care collection implementation. Attendance at these workshops has been very strong, which is good because the aim is to increase the awareness of the importance of data in demonstrating to insurers and other purchasers the value of what private psychiatric hospitals deliver. Rehabilitation is another area of service which sometimes attracts controversy. Every year, private hospitals provide more than 260,000 rehabilitation separations. Many of these are single-day separations for people attending day programs. Team-based multidisciplinary care is at the centre of our rehabilitation services. When patients are admitted overnight, every aspect of the care team's interaction is focused for that 24 hours, 7 days a week on achieving functional improvement. For others, it is day programs that are found to be more effective route to achieving their goals. As our population ages and the conditions with which consumers present change, interesting questions arise as to the role of rehabilitation. And not only in supporting patients following an acute episode, but also in the management of chronic diseases and the provision of reconditioning programs to restore function and alleviate the risk of further decline. Our Rehabilitation Committee is chaired by Vincent Borg, and while it may be small in number, it is certainly energetic in engaging with these issues. The committee supports the sector's participation in the Consultative Committee on Private Rehabilitation, which brings hospitals and health insurer representatives together. The committee is also very keen to promote awareness of research being conducted in the private sector, particularly research that informs consideration of the issues I've just previously mentioned. One of the most interesting yet complex issues discussed in the Harper Review on competition policy was the question of whether governments should more actively promote competition in the provision of human services. It has long been acknowledged that the public and private sectors are both indispensable in the provision of effective and efficient health services throughout Australia. Yet many tensions remain which work against the best outcomes for taxpayers and consumers alike. More than 1 in 5 privately insured episodes are treated in public hospitals. This is a cost in capacity terms of more than 7,000 beds, a resource which could be used to address intractable public waiting lists. Whilst the argument is made that the practice provides the public sector with an essential additional source of revenue, the reality is that this care is heavily subsidised by the government. The cost to the Commonwealth alone is estimated to be in excess of $1.5 billion. The facts are very clear. The fact is that the private hospital sector is essential to Australia's healthcare system. We know it, but it is a reality that often eludes others. Sadly and frustratingly, even those with responsibility for health policy and provision, until they experience the care we deliver firsthand. Based on statistics published by the Australian Institute of Health and Welfare, private hospitals provide care for 40% of all Australian hospital separations. We provide almost half of all heart procedures. And, as Madonna said, more than half of all surgeries performed in Australia are performed in private hospitals. The fact is that Australia does have a very good balanced healthcare system. Nearly half of all Australian hospitals are private. Our sector performed 70% of all eye procedures. We provide almost half of all chemotherapy and 70% of all admissions for rehabilitation. Promotion of our sector is important to dispel the myths and misconceptions that remain. And that's something that APHA has worked very hard on for the past number of years, but none more so than in the last 12 months. APHA has been energetic and innovative in spreading the good stories that our sector has to tell. The website phnews.org.au provides a news hub carrying many articles and videos, and if you haven't had a chance to look at it, I would really encourage you to do so. APHA is also very active in promoting your stories on Facebook, Twitter and LinkedIn. They are, after all, like them or not, the places where people talk about us. And without sharing our stories in that medium, we leave people to make up their own minds. In one of the most important statements to date, the ACCC, in publishing its annual review on public health, went so far to say a number of things. They said, there are market failures in private health insurance industry which reduces consumers' ability to compare policies and make informed choices about their future medical needs. They also said, as insurers respond to market demands for affordable policies, there are greater risks of unexpected out-of-pocket costs for consumers. Current practices by some insurers are at risk of breaching the consumer laws, was also a statement that they made. The APHA was thrilled when Minister Susan Lee subsequently announced her intention to conduct consultation on private health insurance. Already, one initiative to flow from this consultation has been the establishment of an industry reference group to examine the prostheses list, and the APHA has been strongly welcoming of this move to bring all stakeholders to the table. The prostheses list is an example of where consumer protection and access to appropriate care requires careful and appropriate regulation for the cooperation of all stakeholders. It is not an area where there is a simple solution, and it's certainly not an area where quick savings can be made. Other areas where APHA looks forward to ongoing engagement and reform include the review of second-tier arrangements. This is very important to ensure that they fulfil their original intent, and that is of protecting consumer choice, protecting the value of their investment in their private health insurance product, and protecting consumers from excessive out-of-pocket costs. Removal of government incentives for junk policies, or what we would say are policies that do nothing to alleviate the reliance on the public hospital system. Provision of better information for consumers, including clear and concise definitions. Consideration of an increased level of allowable excess payments so that consumers will have much greater flexibility in managing the cost of their health insurance, while at the same time ensuring that their healthcare needs can be met and that their policy meets their needs. It is to be hoped too that there will be a greater scope to explore opportunities for innovation to tackle the challenges, particularly in the chronic disease area that I've already spoken about. Confronted with all of these challenges, it is more important than ever to remember the people who on a day-to-day basis make the private hospital sector happen. Not just the people in this auditorium, but the people back in our facilities, the human faces of healthcare, the clinical, administration and support staff that are on the ground that deliver the care to our patients. The health sector is second only to the retail sector in the number of people we employ and work with. The private hospital sector directly employs close to 62,500 full-time equivalents, ranging from salaried medical officers, allied health, registered and enrolled nurses, clinical support staff, administrative and clerical staff, right through to domestic, personal care, maintenance, tradesmen, and a raft of other staff. It is an enormous responsibility and a major challenge as we look to the future, where we will increasingly compete with other fast-growing sectors. APHA's advocacy in this area is led by the Workforce Task Force that is chaired by Malcolm Passmore. Last year, APHA, in partnership with Catholic Health Australia and with the assistance from Paxton Partners, conducted a major survey in the private sector's investment in education and training. Analysis is currently underway, and it's important to note that this is the first time in 10 years that a project of this type has been attempted. The landscape has changed so much in that decade, and entirely new methodology and approach was required to this survey. I would like to thank you all for the organisations that participated, and certainly at APHA we are very much looking forward to sharing the results with you later this financial year. I know it was a big ask, and thank you, David, as well for doing it for us. But it really is important. Without data and without something that we can hang our hat on, we actually don't have anything to form arguments to change things. Our effectiveness at APHA also resides not just in the submissions we write, but perhaps even more importantly in our capacity to field nominees to literally dozens and dozens of committees and working parties. We're only able to do this because of the willingness of you, our members, to nominate and support valued staff and clinicians in undertaking, on top of their already busy day jobs, the responsibility for representing our industry. It is vital work, and it is so important to have skilled and experienced voices to defend, promote, and represent our industry. So thank you to everyone who has allowed staff to participate, and thank you to those representatives for the hard work and effort that they put into that representation. Well, this is the challenge right now, isn't it? And it is actually the reason for this Congress's theme. Quality, one agenda that really never changes. Consumers expect it, insurers and other purchasers expect it, governments certainly expect it, and our reputations depend on it. In the last year, some sought to make headlines out of it, as with the Medibank claims. But more serious conversations also emerged. Some were challenging, the RAC's bullying inquiry. Some were quite baffling, the Australian Atlas on Healthcare Variation, and we'll hear later from Professor Anne Duggan, and she'll shine some light on that for us. Some highlighting that we still have a significant way to go in understanding how to collect and use our data. Collection of data on clinical complications. Our final plenary session tomorrow will canvass the views of the Commission, the insurers, and the AMA. Whether it's challenging, baffling, or welcome, all of it is exciting because it is what motivates our people. And at the end of the day, it is the reason that we exist. I have the honour of chairing the APHA's Safety and Quality Task Force, and I would like to acknowledge the tireless work of the members of that task force. They've had a gruelling work schedule for a sustained number of years now, with no sign of the issues or workload lessening in the foreseeable future. Of course, the major focus has been on the active engagement with the Australian Commission for Safety and Quality in Healthcare across its entire work program, and that program is a large one. We've, of course, in the past 12 months, focused on the review of the National Safety and Quality Health Service Standards. This is the task force also that fields nominations to various working groups and advisory committees that actively supports the dissemination of information to you all. It's very busy, and these are very dedicated people. As part of the Congress, we look forward to engaging with a number of key individuals, and we'll be doing that throughout the Congress. After morning tea, we will hear from Minister Susan Lee, Professor Michael Buist, and his powerful message from a consumer perspective, the Commission, with two very timely and topical sessions, clinicians and managers who work in our own sector, but who also come from outside of it, experts who support us. The hypothetical moderated by Shane Evans from Minter Ellison should not be missed. And also people from outside our sector. Antarctic Expedition Leader Rachel Robertson will share her insights into keeping the team inspired and productive in the bleakest of conditions, and certainly we can see some parallels there. Insurers, I extend a very special welcome to the new CEO of PHA, Rachel David, who will join the Making Quality Count panel in our last session. It's also a time and a privilege to hear from those within our industry. We have a number of senior clinical and organisational leaders from within our member hospitals who will join panels throughout the Congress. APHA also looks forward to learning from you about your issues, about your responses to the next 2 days, and how we continue to support the private hospital industry and support you, our members, to fulfil your missions. The Safety and Quality Task Force has been developing a proposal to provide a comprehensive benchmarking service across the membership through Chapel Dean. This is a service that will be additional to membership of APHA, but it's important to realise that it is much, much more than just a benchmarking service. It is a vital step in private hospitals being able to refocus and regain the agenda. The agenda, of course, is the demonstration of safety and quality within our own facilities. This is our business. Therefore, this is our responsibility, and it is an activity that must be driven from within, instead of being dictated by ad hoc approaches by those external to our organisations who all too often game the results. This proposal will also facilitate a collaboration that will enable us to have a true understanding of the sector's data, and most importantly, how that data can inform and drive quality. It provides the opportunity for us to work collectively, which will see us achieving much more than working in isolation. It will also, importantly, enable APHA to effectively communicate what we do, to stand up and be proud of the data and the quality and safety that we provide in our own hospitals. I would like to acknowledge our APHA sponsors and to extend our thanks for your valuable and much appreciated contribution to our sector. I would also like to echo Michael's thank you to our Congress sponsors, whose contribution make this event possible. Also, as Michael said last night, our trade exhibitors are an important component of the Congress, and I would urge you all to pay them a visit during the breaks. The vital work of the APHA task forces is made possible by those that chair them. The APHA task forces are made up of members drawn from within our representational council, with additional expertise that is often drawn from member hospitals. Each task force is chaired by a member of the APHA board, and I would like to extend a very special thank you to my fellow board members for their diligence in steering the task forces through their quite substantial workloads, as well as the considerable time and effort that they commit beyond those task forces to the governance and direction of APHA. Could I now ask all of the board members who are here to just stand, please? So I'd like to thank Danny, like to thank Phil Curry, and especially to thank Phil, who chairs the Finance, Audit and Risk Committee. Just couldn't do a slide about that, Phil. Malcolm Passmore, over there. Robert Cusack, Anne Crouch, Alan Boston, the newbie, Robert Cook, and Alan Cooper. Please make an effort to see these people throughout the Congress. They really would love to hear what they can do more and what APHA can do more for you. Finally, but most importantly, I would like to acknowledge and thank the APHA staff. It's certainly the board who provide the soul of our industry, but it is the Secretariat who provide the heart and backbone of the association. This team is nothing short of remarkable, and whether it is behind the scenes, in the spotlight, or at the hard grind of research and information gathering and analysis, our industry could not be in better hands. Now, Michael, I'll get you to stand up. Michael Roth, the CEO, long-standing, steadfast, It's been standing for a long time. Steadfast and professional leadership of the association is truly commendable. And his ability to stay calm under any circumstance is legendary and provides us good stead, particularly in some of those fiery debates. Lucy Cheetham. Lucy is the Director of Policy and Research. Her intellectual ability and work ethic is outstanding and only surpassed by her dedication. Her direct support across our task forces and committees seems limitless and endless. Quite simply, Lucy is exceptional. Lisa. Lisa Ramshaw, the Director of Communications and Marketing, who, with sadness, we will be farewelling tonight after 8 years with APHA. I think all of you would agree her mark on APHA is significant. The gains we have made in the positive profile of private hospitals are the result of her hard work and determination and of dragging us screamingly towards social media. Anthony Perry. Anthony, where are you? He's working, he is. Communications Officer. Anthony, your innovative work on our publications, presentations and communications is absolutely notable, and I think everyone can tell the difference since you've joined the association, so thank you. There are some members of APHA who aren't present, but nonetheless, certainly no less important. Ruth McGorman-Mann, the Director of Finance and Administration. Peter McDonald, Manager, Data Analysis and Research. Sabah Khan, Finance and Database Officer. Andrea Verstegen, Officer and Membership Officer. And Mika Camps, who's currently on parental leave. Lastly, I would actually like to welcome a new member, Frith Rayner, who has been appointed as the new Director of Communications and Marketing, and what a perfect place to start at our Congress where she can meet many of you. So please, over the next couple of days, say farewell to Lisa, but say hello to Frith. Could you all join me in a round of applause? I think all too often we come to events like this, we learn a lot, we get a lot of information. I think we can forget the work that goes on behind the scenes. And the APHA Secretariat is not a large secretariat by any stretch, but to feel the amount of work and advocacy that they do on our behalf is absolutely outstanding. And we should all be proud of the association and the work that they do. Now, I've finished. And I've actually finished a couple of minutes early, so I may have to dance and sing. Are you coming to join me, Madonna?